Good afternoon and welcome to this small discussion about the present scenario of the COVID and the epidemic that has taken up as a pandemic and is going through the world like it's as if nobody's business. So a virus has created this pandemic and we are all affected and badly affected. So here we are, and what do we see, what do we know about this pandemic that is already there? So of course we all know that it is the novel coronavirus, and it is a virus which is called the SARS-CoV-2, which was detected to be transmitted from one person to the other, and this transmission has gone on worldwide to create this pandemic. And today, as we see the figures mounting, we see that nearly 7.24 lakhs of people have been affected worldwide, and 199 nations are reeling under this pandemic. There have been over 34,000 deaths across the world. A figure that is so staggering, remembering the fact that this disease is a pandemic. It is going on from nation to nation, from person to person, from state to state, not realizing whether the person is a queen, is a prince, is the head of the state, or an ordinary person living in the villages. So we are here today to understand the situation, and this situation, how it has affected India. India, very fortunately, was one of the later countries that was affected. And in a country like India, with a population so large, we have had the benefit of understanding, of knowing that yes, this is what it is, and these are the steps that we need to take. And the government, the NGOs, and the help is coming from all and sundry. Everyone is ready to help. And we are here also that, yes, we are there for you. The health medical personnel, the health team is there to look after you. So there's no guarantee of a treatment, nor there is a guarantee of a vaccine. But what is guaranteed is social distancing, and social distancing is the word that is there to go. So be distanced in the social fields and stay at home, stay safe. So now here we are with the medical fraternity. We have a problem that our patients are not able to reach us. In such a situation, how do we take care of our patients? Are we able to take care of them? Yes, we are. And in a situation as dire as this, what we have to do is we have to take care of all the emergency situations of our patients. However, those that are not emergencies can be pushed back a little, of course, with your doctor's advice. So from the eye point of view, and eye is what we are going to deal with today, and I happen to be an eye doctor. I am an eye surgeon at BBI Foundation, Kolkata, and I also happen to be the chairman of the scientific committee of AIOS. I'm here to help you understand your problems of the eye as per the pandemic that is occurring today. So what are the emergency situations in which you need to be with us? You need to tell us that this is an emergency. So an emergency situation would be defined as if there's a sudden redness of your eye, if there's sudden pain, and if it is severe and you have not experienced it before, this is an emergency situation. If there's sudden photophobia or you are not able to tolerate light, this is an emergency situation. If there is a lot of flashes suddenly appearing in your view, or floaters, something like hundreds or thousands of black spots coming into view. So this would be an emergency situation. If unfortunately, even while staying indoor, you have sustained trauma to the eye, suddenly you have been afflicted, maybe a toy has hit your eye, maybe a fingernail injury to the eye, or in the washrooms if a sprinkle of chemical has gone into the eye. So this can be an emergency situation. And for all these emergency situations, do get in touch with your doctor, with your eye doctor, and he'll be there to help you. So these are the importance of the emergency situations. Also, our patients would feel very worried if they have undergone an eye operation in the recent past. So there are patients calling us up and saying, what do I do, doctor? Because there is, I have got an eye operation done. And today with this eye operation, there is sudden redness of the eye. So that again is an important aspect, and we need to deal with such a patient who has a sudden redness in the eye after an eye operation. Also, we need to remember that if there is sudden discharge of the eye after an eye operation, or if the patient had regained good vision after a particular eye operation, and then suddenly the vision drops. So in such patients, it's important that they seek help, they seek medical help. Of course, after an eye operation, one is expected to have some amount of pain, discomfort. So for a patient who has undergone an eye operation and there is sudden increase of pain, something that was not felt in the past or just post-operatively. So this is a situation in which you need to take help. Now, the biggest problem with our patients, and our patients keep complaining that, doctor, I cannot reach you. And that is definitely a problem. But in these times of stress and this endemic that is there, what all doctors have done is the doctor is available on phone, the counselors would be available on phone, and we can listen to you, we can talk to you, and we can help you through a telephone. The WhatsApp and the other social media is there. If you can click a photograph of the eye, the help can become a little better. We will not be able to give a consultation for you, but we can guide you whether your condition is a problem that needs to be solved immediately, or can it wait a little. So with all these things in mind, do be in touch with your eye doctor for any problem that you are having, or if you are having a problem reaching your eye doctor, the names of the counselors would be there, the phone numbers of the counselors would be there, helplines of your locality eye doctors would be there, and do get in touch for anything that you need. There have been quite a number of questions, and in these questions, our patients have called us, and one very important question, and which has occurred time and again, is, can coronavirus spread through tears? Well, to tell you very frankly, there is a possibility that the coronavirus can be transmitted through tears, but it is a possibility which is not so much. And this is a contagious disease. The contagion can be transmitted from one person to the other in many different ways, and we have all known the fact that transmission through hand is the most important way of transmitting. So a very good friend of mine this morning asked that, how do I touch my eyes if my eyes are going to contaminate my hands are going to contaminate my eyes? So how do I touch my eyes? So that it's a very simple question, but a very important one, because we keep touching our eyes, we keep rubbing our eyes. At this time, if you have to touch your eyes, nose, and mouth, it should be washed well, and with a soap. 20 seconds is what is supposed to be done. 20 seconds of scrubbing, of nicely making a foam, and then washing it, having it dry, and then of course the coronavirus, even if it was there in your hands, is not there anymore. You can safely touch your eyes, nose, and mouth. But again, remembering the fact that if somebody has the possibility of keeping on touching his eyes, it's best to wear a pair of glasses or a pair of shades so as to avoid touching the eyes. Another very important question and very pertinent to our patients was, does coronavirus affect the eyes? If this infection goes to the eyes, will I lose my vision? Well, such a loss of vision has not been noted anywhere in the world today. But yes, it might cause something like a conjunctivitis, which is a pink eye or a red eye. And this pink eye or a red eye can come as one of the signs in which the coronavirus is there in some form, in some stage in the eye. So again, if you have been in touch with a patient who is positive COVID and you develop redness of the eye, you have to be very, very careful and tell that you have a redness of the eye after being in contact with a COVID patient. So this is important, and please remember that if your eyes have been infected in some way or the other with COVID, it is capable of transmitting this disease to someone else as well. Now, another question was, and do not smile at this at all, please. And the question was, how can I protect my eyes from the virus? Can I wear glasses and protect my eyes? Well, protecting your eyes from the virus just by a pair of glasses is not possible. But yes, what becomes important is that you have reduced the possibility of getting in contact with your eyes with your hand, and that is important. So this is important, and of course, if you're dealing with COVID patients and you're a healthcare person, and you have to be near a COVID patient. So it's important to keep that distance and to wear proper eye gear so as to be protected from a positive COVID patient. A few questions come up, and one of these questions is, my eye doctor had asked me to go in for an operation. আমার চোখের ডাক্তারবাবু আমাকে বলেছিলেন যে যত তাড়াতাড়ি সম্ভব छानी ऑपरेशन करिए नीन. और इट वाज हमारा डॉक्टर साहब ने हमें कहा था कि मोतियाबिंद का ऑपरेशन आप जल्द से जल्द करा लें. तो अब मैं क्या करूं? अब मैं यही करूं कि अगर हमारे डॉक्टर साहब ने कहा था कि ये इमरजेंसी है तो हमें करा लेना चाहिए. But if it is not an emergency, and your eye doctor would be the right person to say that, because at times the cataract can be an emergency, however, very, very small possibility, but at times it can be, and your eye doctor will counsel you whether it has been an emergency or not. Otherwise, a routine cataract or a routine refractive surgery is not an emergency. But what is an emergency is an infection within the eye, something that we call endophthalmitis. What is an emergency? If the pressure of the eye has suddenly gone up, and that is called an acute congestive glaucoma, then it is an emergency. And if a foreign body has gone inside the eye, or if the eye has been traumatized, then of course it is an emergency. And for all these conditions, an emergency operation definitely will be required. Another question that has come up time and again is, my doctor had prescribed me certain medicines, how long do I go on? So how long? Your eye doctor would have definitely prescribed for you, and that this prescription would definitely define to continue. If it is written to continue, you must continue. If it is written that stop after a month, you must stop after a month. And do not continue until the prescription says to continue. However, there are certain eye drops that need to be continued for example, glaucoma patients. If your doctor has prescribed eye drops for your glaucoma and has written continue, please do continue. And if you are in doubt, please get in touch with him or his counselor to get more clarity of the situation. Now, another difficulty, of course, is in these hard times is the getting the eye medications. The pharmacies have to be open. Most of them are definitely open, but there are often queues on the pharmacy, and this queue deters so many of us being in close contact with one another along these queues. So in such a condition, definitely you need to procure the eye medicines from your pharmacist, and of course you must continue with the eye medicines. There's a question here, and Shanaz asks us, during this time of this pandemic, doctors prescribing medicines or their substitutes through teleconferencing are not available, and are not available. So again, your doctor can definitely advise you certain alternative medicines that might be available, and if such is definitely available, then you can go in for that. But do ask your doctor which substitute he would like you to go in for. We have so many diabetic patients, and our patients with eye problem and diabetes are a large number. So there could have been a diabetic patient. If you're a diabetic patient and your doctor said that you must routinely get a diabetic eye checkup done every 6 months, and your 6th month is this month and maybe this week. So what do you do? Do you go to and rush to him? Well, if it is a routine diabetic eye checkup and you are not having any difficulty what you had previously, or your vision and all other parameters are stable, you can continue with any medication that he might have prescribed, or your diabetologist's medication must definitely go on, and then you can take an appointment maybe once the lockdown is over and go ahead. What if for a diabetic patient the vision drops suddenly and he sees suddenly a cloud in front of his vision? What do you do? So this is again an emergency, and definitely get in touch with the hospital that you have been to for your eye checkup or your eye doctor, and that is important for us. Children, and we all get concerned about our children, and right now children have to be indoors, like it or not, and which is a very, very trying time, not only for the kids but also for the adults. And in such times, what is very important is the children are on screen time. So we as eye doctors have always said, if you should not be on screen time much, and maybe just 45 minutes to an hour, and that's all, and that is the limit of the screen time that we have drawn for so many children, and so many parents abided by this. But what about today? Today, when the children are indoors, can we modify these suggestions and advice? Well, yes, we can, because the children have to be engaged as well. They have to go on to e-learning at times as well. You can allow them to watch the screen, but best be a screen from a distance. So a television monitor is a better screen than the iPad or the iPhone or the phone. So just keep it in mind, and no permanent damage is done if for a matter of 3 weeks or 4 weeks the child watches the screen more than he's supposed to. So let him. But in between, definitely there are indoor games that can be played, and definitely there are so many things that can be done without the screen as well. A Ludo, a pack of cards. All these are possibilities. There is a question here, and one of our friends have said, my glasses are broken, what should I do? Yes. So if your glasses are broken, definitely you need to get a pair of glasses, and the opticians are supposed to be open at this time, but they might not be open as well. So if you have your previous prescription, and if you can get an optician to make them for you, the previous prescription glass would suffice at this point of time. Now again, there is another question: are contact lenses safe to use? And what is the ideal screen time for a child? Well, contact lenses, are they safe to use, is something that I would like to answer for you right away. And the answer to this is, well, if you can avoid contact lenses, it's best so. But of course, if somebody has to wear contact lenses and very high powers and used to wearing the contact lenses, then definitely go ahead and wear it. But be sure that you clean it properly. You can apply certain lubricating eye drops even on the contact lenses, and do not wear it beyond the prescribed hours. So 8 hours is best. Take them off, get a relief, and if you have to wear them again, you can wear them. But there are some contact lenses that can be worn for 10 to 12 hours safely as well. So again, if you have a doubt, you can consult your eye doctor. What is the ideal time, ideal screen time for a child? Yes. So this again, this question, of course, we did answer, and the ideal screen time for a child in a normal situation is just about 45 minutes to an hour for his entertainment. But beyond that, it's best to reduce the screen time. And if we can reduce the screen time and allow the child to play outside, outdoors, of course, not in this situation, then definitely it is good for the child's health and eye health as well. I'm not talking of the situation where we are in today in a lockdown period with the pandemic here. I'm talking about the normal circumstances where a child should be allowed to play and inspired to play outdoors. So with this, there has been a question. Yes, this is an important question. One of our patients who has a child asked that my child has lazy eye and he was supposed to be patched. Means the eye, that is his good eye, was supposed to be patched, and he's supposed to see with his lazy eye for 3 to 4 hours a day. So in these times, should we continue with the patching, or it's called an amblyopia therapy? Yes, you should continue, and the child and the child can be inspired to watch the screen with his patching on, so that with the eye that is patched, he does not see, and the eye which is lazy for him, with that he is inspired to see. So if something like this has been asked to do by your eye doctor, please go ahead and continue with the patching. So screen time, maybe a few precautions which would be applicable for children as well as for adults. So breaks every 20 minutes is good, and at least for 20 seconds look away, and to look away 20 feet or beyond. So 20, 20, 20. Take breaks every 20 minutes, at least for 20 seconds, and to look away 20 feet away. So this is one aspect of the screen time, and of course the computer screen, if it can be a little below the eye level, that is good. And lubricating eye drops are important if the screen time is very long. And of course the IT professionals who are working from home, definitely what is important is lubricate your eyes, splash water into the eyes if you're working for 10-12 hours over the screen. So these are important, but also as important is during this lockdown period, you need to exercise as well. Exercise not only your eyes, but your mind and your body as well. So difficult at times, but so many exercises are possible at home while you're staying with your family. So exercise with your family, eat with your family and have a great time with your family. So this is important for the uh, lockdown period and here today. So, another question that came in, and that was about the allergy and the eye. So, people tend to have allergies, and this is a season in which allergies are quite rampant. And if you have the same irritation, itching that you had maybe a year ago in this time, in the springtime, then possibly, and you're not able to get in touch with your eye doctor, you can use some lubricants which is innocuous and they will not harm you. But for any other medication, it's best to get in touch with your eye doctor or the eye hospital where you have been to. At times, if you look back on your medication, on your previous prescription, there might have been steroids written in those prescription. Please do not use steroids without asking your eye doctor if you should or not, because these are important medications which can do a lot of good, but at times can be harmful if it is not for the right eye condition. Dry eye. Dry eye is another factor, and we as doctors continue to treat dry eye. And for this condition, at times, we definitely need to give lubricant eye drops. And lubricant eye drops are one set of eye drop that can be continued, and you can continue the lubricants even without your doctor's advice at this time of stress. Now, as we come to the final stages of this discussion that we have had, there is one thing that so many patients of ours, family members, everyone is wanting to know: when are we going to start our routine checkup practices? When are we going to give routine appointments and not just emergency appointments? So this is what we have told our patients, and they continue asking. So it's only when the government directive comes and the health official directive comes, and given a condition as a pandemic, there might be a delay and there might be a slowdown, there might be a gradual intake of our patients, but we will be waiting for the government directives for this to happen. Till then, we definitely have to abide by all that we are doing. The government directives have to be followed, and you have to be in tune with all the exercise of a lockdown period. And I speak on behalf of all my colleagues, ophthalmologists, doctors, and healthcare professionals who at this time are there for you, fighting for you. And let us remember all our colleagues who are in the front line of the treatment as has to be given today to the COVID patients, to patients who are COVID positive, remembering the fact that it can be transmitted to the healthcare professionals, doctors, nurses, and other personnel who are dealing directly with the healthcare. And such patients definitely have to be treated. And let us remember that they are putting themselves at risk, and let us be there for them. Let us inspire them. Let us try and do as much from our own end, my own bit. If I can help in any other way, I should, and I should come forward and give this help, because there are so many colleagues who are there in the front line. So many more would be needed in the front line. So as and when required, let us all remember that we must be there for our colleagues in the front line to help them whenever and however they need. If there are no other questions, okay, there's a question here. And I just wanted to know that my grandparents should take extra care on Karuna and eye-related issues. Yes, grandparents definitely should take extra care otherwise as well, because the elderly people, especially people who are over 65, they should maintain strictness of not going out at all and not coming in contact with any possibility of transmission of the virus. So even if it is possible, they remain absolutely in one room if it is possible and stay like that. And of course, maintain all the health and hygiene that has been instituted as of now. And there's another question from one of our viewers, and I have no pain in throat but a little irritation and drinking ginger tea regularly and lukewarm water, otherwise I'm in fit condition. So very nice. I mean, that's the way to go. And drinking warm drinks, tea, coffee every half an hour is something that has been told by our colleague doctors. And this definitely can be taken up, and definitely this is correct, and but you have to maintain all the health and hygiene tips that have been given to each one of us. And is there any other question? And if there are none, then maybe we can call it a day. But if there are any other questions, I'll be very happy to answer them. So as it has been very well said, that this is not only a time to stay safe, stay home, but to stay also within oneself. And introspection is something that each one should do in these times where the other stress and strain of life has been removed. And introspection is something that is important for each one of us in each of our daily routine. Okay, there's another question here. I have temperature, cough, fever with redness, discharge and watering. No private doctors do not want to see me. Whom should I see? So this is a situation in which definitely you need to be seen. Temperature, cough, fever with redness, discharge and watering of the eyes definitely needs to be seen. And if no private doctors are available, if you're not able to get in touch with your doctor or with the hospital that you've been to, there are the government hospitals which are very much open, and the eye checkups are going on. So do get in touch with any government eye checkup in your locality if you're not able to get in touch with your eye doctor. Okay, so we have a few other questions. How contagious is this disease via tears? Well, there have been a few studies that have come up, and the contagion is possibly there through the tears, and some studies have said that there might not be a contagion through the tears. So, but let us play safe, and let us understand that some studies which have said that the contagion can be transmitted through tears is something that we have to take into account this time. Please give the timings when you will be available. Okay, please share the timings when you will be available. Well, I'm available, and the phone numbers that are there on my prescription, they are there for everyone to call, and my counselors, my optometrists are all there to help, and I'm of course there. Sir, would you recommend any common eye exercise for elderly patients with home lockdown? They are restless. No, eye exercise for elderly patients, not really done. I mean, please let your elderly people watch the TV and be on line and, WhatsApp and everything that they wish to do. That's fine, absolutely. Would you recommend any eye exercise that's done? As a professional, we are working from home, so laptop tab uses increase from 2 to 3 hours to 10 hours. What should we? Well, yes, this is something that it definitely is happening, and we address this question. Yes, you can use the screen time over a long period, but in between. So what we just said is 20, 20, 20. So every 20 minutes you can look up from your screen and for 20 seconds you can stare at an object or at a distance 20 feet away. So 20, 20, 20. And of course you can put lubricating eye drops in the eyes. Wash your hands before you touch your eyes, and you can splash water, the tap water into the eyes, which is not going to be affected by the coronavirus. And but of course, after you have washed your hands, then only splash water. Is there a dry eye problem in glaucoma? Well, a dry eye problem in certain medications that we use for glaucoma can be there, and these medications, usually the eye doctor prescribes the lubricant along with the medication in such conditions. So if you are using anti-glaucoma medications and your eyes feel dry, you can safely use a lubricant eye drop. So okay, so here we are. So I think we have dealt with certain very, very pertinent questions and certain questions of concern of our patients. And let me again reassure you, all of us eye doctors, the health professionals are all there with you in these very trying times. Let us abide with all the regulatory instructions that have been given by the government, and let us abide by them, because that is safety for you and safety for us. Should full eye be covered before going out? No, well, to take it on the lighter side, if you cover full eyes, how do you go out? How do you find your way? So, but yes, you don't need to cover your full eyes. If you're going to the marketplace and to get some provisions, you don't need to cover your full eyes. Maybe at most you can wear a pair of shades, or you can wear your glasses. So that is absolutely fine. Any specific eye symptoms related to corona? Okay, we just discussed this, but someone has asked, so maybe I can just round it up once more. So eye symptoms related directly to corona is something called a follicular conjunctivitis, and that might come up with symptoms of irritation, itching, watering, and redness of the eyes. So this can happen, and there can be an associated pain factor as well. So if something like this happens, but if it is associated with any symptoms of which are fever or upper respiratory tract infection, if you are having cough, if you are having these symptoms associated with the pink eye, then definitely you need to check out with your not only your eye doctor but also your general physician as well. So this is it. I think we have covered some questions which are very frequently asked, and if there's anything more, definitely you can text, and you can get in touch with your eye doctors, your eye hospitals. And thank you very much for being with us, all of you, and discussing these things. We can be on live again and to discuss any other problems that is necessary to be addressed. Thank you very much. Thank you. And have a very, very safe 3 weeks period in this pandemic, and definitely inspire all your family members, your friends, your colleagues to stay safe. Thank you. Stay safe. There's one query here. Olopatadine eye drop is not easily available. Any other alternative you may suggest? Well, definitely do get in touch again with your eye doctor, but ketorolac is something that is also possible as an anti-allergic medication, which you can again safely give. So this is something that you can do. So thank you all to all our viewers, and I was really very happy to be here on Speak Health, and thanks a lot for sparing your time. Thank you very much. Thank you. Stay safe.